Well, today at a conference in Liberia, the World Health Organization is releasing its report addressing the challenges of women's health in Africa. The WHO is also releasing its World Malaria Report for 2012. The malaria report includes the latest data from 104 endemic countries and a range of partners. For more on the event, we're joined on the phone by Africa Health Network reporter Linord Moudou, who is attending the conference in Monrovia. Hi, Linord.
Hello, Dimiake.
So good to have you on the phone. So if you could just summarize for us the launch today of the women's health issues as well as the report on malaria.
Yes, so as you mentioned, it was the official launch of the Women's Health Commission report and the World Malaria Report 2012. It's the presence of the President of the Republic of Liberia, Johnson Sirleaf, is also the distinguished honorary president of the Women's Health Commission for the African region and the chair of the African Leaders Malaria Alliance. Also attending was Dr. Gomez Sambo, who is the World Health Organization Regional Director for Africa. In summary, the report on the Women's Commission demonstrates the important role of women in Africa. More importantly, their need for access to care. Some of the findings, the report talks about how African women bear an unacceptably huge burden of disease and death. They account for more than half of deaths of women worldwide due to communicable diseases, maternal and prenatal conditions, and nutritional deficiencies. There is also a multi-sectoral approach that is needed to improve women's health. And there is an under-investment in women's health care, which is one of the many challenges that needs to be overcome. That's what the report talks about. Now, in terms of addressing these issues, they talk about mobilizing political will and commitment. This is something that has been talked about over the years, how it's important that the leaders, the political leaders, get involved. And we've seen some leaders that have shown support in terms of women's health and gender issues, but the report shows that there is a need for more political will, and also supporting women's health and development throughout the life course is important. It's not just when the woman wants to give birth, when she's pregnant, or when she has a specific disease like HIV/AIDS. It's an ongoing process starting from the girl child, for example, who needs to get an education, she needs adequate nutrition, she needs to get empowered, and this is a whole process to ensure that women are healthy and they go through life.
All right. Before we run out of time, a little bit also on the malaria. I understand that there's been some progress registered, at least in terms of a reduction in the malaria deaths over the years. Rwanda, Cape Verde, the two countries in particular. Overall, what are they anticipating?
Yes, well, as you mentioned, these two countries are examples of, success stories. In general, 12 countries in the WHO region, Africa region, have reduced morbidity and mortality of malaria. So that's good news. Another good news is that there is a change in the malaria incidence and mortality, which approximately half of countries with ongoing malaria transmission are on track to meet the World Health Assembly and the rollback malaria target, which is to achieve a 75% reduction in malaria cases by 2015 compared to 2000. So these are the good news, some of the good news, but there is also a need for improvement. Of course, they talk about the need for more surveillance, because if you don't account for how many people are getting sick, how many people are getting treated, it's very, very hard to move forward with regards to malaria control. So yes, the report is very optimistic with regards to malaria, but there are some drawbacks, such as funding also is one of the challenges. International funding for malaria control.
Well, thank you so much, Linord. I think you tied that down very well for us. That's Linord Moudou, Africa Health Network reporter, who joined us on the phone from Monrovia in Liberia.